Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our Facebooks Live. Today is May the 7th, 2001. We've been doing this now for 14 or 15 months. It seems like a very long time, but I think there's some good news on the horizon here, and I'd like to share that with you today. Again, this is your chance to get your questions answered. Some people already sent us these questions at our Facebook Live site, which is Facebook Questions at DouglasPublicHealthNetwork.org. And if you'd like to send us questions, that's great. It gives us two opportunities. One, if they're longer questions, we can deal with those questions. And if they require some research, I do that research beforehand. But nonetheless, we'll take your questions as they come up. As we always do, we start at the top of the world situation and then move down to the local situation. Still in the world, still a very active pandemic, 158 million cases. It's a lot of people. 3,279,000 deaths. I mean, 3 million deaths in that. Still very active in the world. Very active in South America, especially Brazil, Uruguay, and this week Argentina. Still active in Europe, in Sweden, France, and Turkey. Active in the Middle East, in Iran, and then very active in India. And India is very worrisome. 300,000 cases a day, every day seeming to increase. News reports from that area suggesting increasingly dire straits. The number of cases hasn't gone up very much, but the reports are that the hospitals are totally overwhelmed and they're just trying to save people's lives and not necessarily reporting cases. And they've run out of testing materials, so they can't test new people. So the numbers may actually even be higher than is stated. And those are just very, 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 very worrisome numbers. In India, there's mostly the 617 variant. In Europe, it's mostly the B117 variant. In South America, it's the P1 variant. So the variants are playing really outsized roles in each of those countries. The good news is that many of the countries in Asia that used only public health measures to keep this down, so things like places like New Zealand, Australia, Taiwan, South Korea, and Vietnam, use public health measures, and they continue to have very low levels of cases. It's very confusing when you deal with this all the time, but I think the best measure is cases per 100,000 people per day. And so what I'll do is when I compare all of these, I'll use cases per 100,000 per day. There's lots of other ways to do it, but so as not to confuse people. Then the good news is Douglas County has just about 100,000 people, so you get a sense of how many cases that would be. So in those places that have been under control, they're typically less than one case per 100,000 per day. And in all of those places, they have relatively no restrictions on people who are already in the country. They still do have very strict restrictions on travelers and people who come into the country, very strict restrictions on people who wind up with the disease and lots of quarantine. But for the everyday life in New Zealand and Taiwan and Australia, things are kind of back to normal. And that's kind of what we've predicted in the past. When cases get less than one or so cases per 100,000 per day, you can get rid of all this other stuff. The good news is that the UK, which did go through a very bad time in the springtime, but has got a lot of people vaccinated, is down not quite to one, but they're about 3 per 100,000 per day, and they're beginning to be able to lift restrictions. When we look at really bad places, like India, there's 20 to 30 cases per day. When you're looking at places like Uruguay, it's 50 cases a day, 50 cases per 100,000 per day. So it's a lot of cases. In the U.S., we're about 15 cases per 100,000 per day. And so there's huge variations in the world, 100-fold differences in the amount of the rate. In the U.S., we're at 33 million cases, we're at 594,000 deaths. You know, when you consider how many people died in World War I or World War II, or how many people died in the 1918 pandemic, that's a huge number. However, it looks like the fourth wave has kind of gone down again, and cases are clearly down. There's no super hot spots in the country, although there's 4 places that I'm watching carefully. Michigan and Minnesota, which had a lot of disease before, okay. But now we're starting to see a little hot spot in central Illinois, not a place we think of very much, like Peoria, Illinois. Colorado pretty much is heating up. We're seeing some heat around Kansas City, Missouri, and Kansas City, Kansas. And then Maine is heating up. There's one area in Arizona that's heating up. So we're having these little, if you think of using the forest fire analogy, little hot spots around there that we're following. But overall, cases are down, and that's a good thing. And I think in most places, cases are coming down as vaccinations go up, and we see a lot of that. In Oregon, we're at 18 cases per 100,000 per day, so a little bit more than the national average. And the cases are in the Tri-County area, but we're also seeing a lot of heat in the Deschutes County area and in Klamath County. So Klamath County is having 40 or 50 cases a day, and they're about half our size. So that's worrisome to have that many cases in Klamath and Deschutes. In fact, Klamath and Deschutes last week had as many cases as they've ever had. So that is a bit worrisome. And we're also seeing a fair amount of disease in the Tri-County area. Hospitalizations in Oregon went up in the wintertime, came down and are up again, but now they look like they've stabilized, but stabilized at 300. So stabilized at a very high level, and sort of a worrisome level. Deaths are down because most of the people in the hospital are young, and most of the people in the hospital will survive. Although what we see is when younger people are in the hospital, they stay in the hospital a long time. So 70 or 80-year-olds get sick. Some choose not to have heroic efforts and they go home. Some get sick and go to the ICU, but old bodies don't tolerate being intubated for a long period of time. Their kidneys don't tolerate being on pressors for a long period of time. And frequently they'll die after a few days in the ICU just because being in the ICU is so hard. But when you get 30s, 40, 50-year-olds in the ICU, 30, 40, 50-year-olds in the ICU can last a long time. And that's what we've seen. So we have two people in their 40s who've been in the ICU for more than 3 months. I mean, 3 months in the ICU is a very, very, very long time. One last year who's recovered, but still not fully recovered. And one who is still in the hospital and may need a lung transplant at one point. In Douglas County, we're kind of in the doldrums. We're in this 6 to 10 a day. We'll have a big day and a little day. But we're certainly kind of stuck at that 6 to 10 per day. We're seeing a lot of spread in workplaces. And in the workplaces, we're seeing the spread. There's very low immunization rates. We're seeing it at social gatherings. We have one social gathering here. I think there's 7 cases from one family gathering. Interestingly, the 7 people who were not vaccinated got the disease, and the people who were vaccinated did not get the disease. You'll hear more of that. And we're also starting to see things in school. The other thing is our hospitalization rate is high. So you've been following our daily numbers. We've had 10 or more people in the hospital every day. So I do these graphs, kind of a nerd here, and I do these graphs and I plot out our average number of cases per day and our average hospitalization. So in the past, we'd have 20 or 30 cases a day and 6 in the hospital, so that the graph of daily cases, or the average of daily cases, would be higher than the average of hospitalizations. And that has been true almost every day of the pandemic. There's been a couple of days early on where they crossed. But for the most part, the average number of cases is higher than the number in the hospital. But over the last week, it's been reversed. So there have been actually more people in the hospital than we've had cases. So you remember over the last few days, we had 12, 13, 14 in the hospital. At a time we had 6 to 10 cases per day. That is very worrisome. And when we look, those people in the hospital are young. So today we have 11 people in the hospital. Only 2 are older than me. For COVID, we've never seen that, right? Where 9 of the 11 who are in the hospital are younger than I am. That's stunning, because these people are not. You don't get into the hospital by just saying, "Oh, I'd like to check myself in." In our modern world, you only get in the hospital if you're really quite sick, and we've had people in their 30s and 40s really pretty sick with this thing. So something has changed, and I think what's changed is that as we have more variants here, we'll talk a little bit more about that later. As we have more variants here, we've been seeing higher degrees of transmissibility and more people in the hospital with that. Now, the other thing that we've seen is very few breakthrough cases. So a breakthrough case is a case where somebody's been fully vaccinated and then still gets sick. So the Oregon reported that there were 600 breakthrough cases in the last few months. It was, oh my God, that's a lot of cases. You have to realize we are having 600 cases a day every day. So if over the last 2 months, we've had 60 times 600 cases over that time, so 36,000 cases. Of those 36,000 cases, only 600 have been breakthrough, suggesting how just incredibly effective the vaccine is. And this is what we see when we look at the cases and the controls, and we know what our vaccination rate is. We come up with vaccine effectiveness again and again of greater than 90%. So really what we need to do to get out of these 10 cases a day doldrums and still have restrictions and worry and people in the hospital is to get enough people vaccinated so we can get down to 1 a day. And if we got down to 1 a day, we'd still pay attention, but a lot of the stuff we're doing, we could stop doing, and that's really our goal. So we'll get there. Got a lot of interesting stuff today that we'll get to, but let me answer your questions. So one of the questions is about booster vaccines. So somebody said, are we going to need booster vaccines? And the answer was, we might. So let me tell you about boosters. Boosters are great. And what boosters do is that boosters, 3 reasons you need boosters. Sometimes you need a booster because the new vaccine comes out, which is so much better than the previous vaccine. So they recommend that people get a dose of the new kind of vaccine. That happens with things like the chickenpox vaccine for adults, or the zoster vaccine that prevents shingles. We'd had a vaccine out there which wasn't very good. They came up with a new one, which is Shingrix. So they recommended people who'd previously gotten the Zostavax to now get the Shingrix. So that's one of the reasons. The second reason that you might do this is that your immunity wanes. So there's some kinds of vaccines you get where you get really good immunity for a few years and then it starts to wane, and by a certain time you need to get a booster shot to build back up your immunity. And that's, for example, with pertussis and tetanus. So people are getting this Tdap shot, not because of anything different, but your immunity wanes. And then in some cases you get it because the germ changes. So the flu germ changes each year. So you need to get a booster each year to deal with the new strains. So the question is, will we need a booster for the Pfizer, the Moderna, or the J&J vaccine? And I think the answer is that you may well. Now, is it sure? No. Is it sure you won't? No. I think you well may. Probably not going to need it because we're going to come with a much better vaccine. You'll likely need it either because the degree of immunity wanes over time and you need to boost it up, or that the virus changes, we get variants, and you need a booster to deal with the variants. So far, after 7 or 8 months, the vaccine immunity does not seem to wane, but if it waned after a year or 2 or 5, nobody would be shocked. The second is about the variants. And we may well get variants for whom the original vaccine doesn't work. So good data came out this week that suggested that the vaccines were really good against the UK variant, well over 90% effective. But when you tested them against the South African variant, which is a 351, they were about 20% less effective. It's still effective, but only about 20% or so less effective. So you could imagine there could be a new variant out there where it would be 40% less effective, and then you would probably need to come up with a booster that would get you a more effective thing. And Vanessa, if you're out there, if you could send me that again. For some reason, I am not being able to find the Facebook Live today. One of the other questions that came up was about, are we going to get vaccines for younger kids? And the answer is, we hope so. Next week, the panel, which is called the ACIP panel is going to meet to look at the Pfizer vaccine for kids 12 to 15. We think that they're going to approve it on the basis of a study that was done by Pfizer that looked at the safety and effectiveness of this vaccine in kids who were 12 to 15. What they showed was it was very effective and appeared to be very safe. And so the good news is it appears to be very effective and very safe. So that's great. I found it, Vanessa. It appeared to be both very safe and very effective. And so vaccines that were very safe and very effective likely get approved. It's not going to be a different vaccine. It's the same vaccine. And so we think it's probably going to get approved for people in the 12 to 15 age group. That would be a good thing because many of our cases are actually in that middle school age group. And those are the kids who are starting to do sports and they're starting to do sleepovers and whatever, the kinds of things where they can spread it to lots of others. So we would like to take a look and see. So Paul says there was a news clip on KVAL where we talked about the Douglas County rates and the state numbers. And so this is a really nerdy discussion. And so let me tell you about that. So in most other counties, almost all of the vaccines that come into the county are provided from the state to the feds, from the feds to the state, and then from the state to the area. So if you're in Lane County, almost all the vaccines are that way. And those vaccines which are given by the state are reported to the state immunization registry called Immunization Alert, and then it goes up to the CDC. When the state pulls the numbers about how many people are vaccinated, they use the alert data, and they have a very accurate data in Lane County. There are a couple of vaccines in Lane County that aren't counted. So, for example, people will go to the VA clinic in Eugene. Those are not counted. And some other federal vaccines that come into Lane County aren't counted. But the Lane County numbers, if you look at the federal numbers and the state numbers, they're very, very similar. When you look at Douglas County, though, two of our biggest vaccine providers are the VA and the Cow Creek. Between them, we know they've given 19,000 doses of vaccine. We have this data from the feds. We know they've given 19,000 doses, in addition to the 58,000 doses that were reported to the state. So we think in Douglas County that 77,000 doses have been given. Now we can't tell how many are fully vaccinated or partially vaccinated, but 77,000 doses. So when you look at our numbers, we look to be about the same as Coos, Curry, Josephine, Jackson, a little lower than Lane County than that. However, when you look just taking the state numbers, since it doesn't have the VA and Cow Creek in it, we look way lower than those other areas. So it's so confusing, but it's really the case. Just an hour ago, I looked at the CDC map, and the CDC map is by different gradations of color. So I don't know the exact numbers, but it's by different gradations of number. And if you look at vaccinations in Douglas County, we're about, just as I said, about the same as the areas around us, a little bit lower than Lane County. But when you look at the Oregon map, we're a pale blue, and the ones around us are darker blue. This is going to take the feds to figure this out, and we're working with Senator Merkley's office, Senator Wyden's office. Senator Warren's office has introduced a bill that would get us this data, and to me it's absolutely maddening. They obviously have the data, right? They couldn't make this map unless they had the data, and their unwillingness to share it with us, to me, is absolutely maddening. In any case, that's my problem. It doesn't have to be your problem. But I think in any case, looking at the numbers and knowing the numbers, Douglas County is about where these other areas are. Still too low. Right? I would love to have 60, 70, 80% of the people vaccinated, but we're not there yet. So Mary says, my husband doesn't want my children to be vaccinated when they're eligible because he's worried about long-term consequences or side effects that we don't know about yet. How do I address that? Well, this is a problem during the pandemic, right? So during the pandemic, we worry because things are happening and they're happening fast. And so when anything new comes out, a new drug, a new vaccine, for anything, you don't know about long-term side effects in the beginning because Most of the things that we test have 6 months of data before they're approved, and they typically don't have long-term data. And so, we're being worried about long-term consequences, not an unreasonable thing. The good news is, when you look at all of the vaccines we've ever done, when you look at almost, I won't say everyone, almost every medicine we've ever done, that significant side effects almost always show up in the first 60 days. So if you are looking for you hear about these medicines advertised on TV, and then the guy in the fast voice says, you can get diarrhea, constipation, headaches, grow an extra arm, but all along the way. All of those things they talk about. Almost all of those show up within 2 months of starting the medicine. There are very few things that show up later on. I would say never, but almost never. So they usually show up in 6 months, in 2 months. And that's why the FDA required 2 months of data on these vaccines before they even got emergency use approval. The usual process in the United States is that after 6 months, you can get full approval, and Pfizer today requested full approval for the vaccine because now they do have 6 months data. And with other drugs, we look for side effects, but not nearly as carefully as we're looking for side effects with these vaccines. People are really scouring for side effects here in the vaccine, and they are really hard to find. The J&J, I think, clearly associated with that clotting, but people have looked carefully for the clotting. With the other ones, they've carefully looked for other things. And actually, I am shocked that there are not more things that you find. I think any drug that you would treat 100 million people with would have a lot of side effects, could have a lot of side effects, and we've just really not seen it. So I think this is a very safe and effective vaccine. And Mary, I think that what you would say to your husband is that we now have 6 months of very good data, and there are no side effects, yet we know that a bunch of kids are getting sick with this disease, and so they should get vaccinated. So Brian says, how many people have died from the COVID vaccines in the United States? This is a really complicated question, and there's a lot of controversy about this. So everyone who dies within a time after the vaccine, the death gets investigated. If the deaths are thought to be related to the vaccine, they're carefully investigated and counted. The only ones that we think are clearly related to the vaccine are those handful of deaths, less than 10 now, related to the clots from the J&J vaccine. Well, clearly more than 10 people, if 100 million people have been vaccinated, clearly more than 10 have died. Many of the people got it were older, many of the people were sicker, and yet we don't know that any of those are related to the vaccine. Is there a possibility that somewhere, and there's certainly a possibility, but we looked pretty carefully and haven't found it. So in our county, several people have gotten the vaccine early on, later died. Again, not shocking that you have 80 and 90-year-olds who got the vaccine, that they later died. We've looked at every single one of those cases. And according to the attending physicians, people who know them best, the vaccine didn't seem to have anything to do with it. So one of the people was a person who had bad cancer and was really declining. And they got the vaccine, and several weeks later they died, apparently, of their cancer. And so that's kind of what you see. We've had no situations where people have died unexpectedly. We've had no situations where people have died without underlying disease. So the story, how many people have died of this disease, died from the COVID vaccines in the U.S., really just a handful. Now, there was a media report by a not particularly trustworthy organization suggests there were hundreds of thousands of people dying, and I get emails all the time about the 14-year-old who died in this. If you're trying to pull one over, don't do that in Douglas County. Because I get to see all the deaths. So if there was a 14-year-old who died in Douglas County, I would pretty much know about it. And so we're really not seeing that. So the vaccine really does appear to be even safer and more effective than I would have ever predicted. So I would not have predicted that we'd be at the 90% effectiveness, and I would not have predicted we'd only have a handful of deaths out of 100 million people vaccinated. So Stacy has two questions. Are people showing up for the Tiger team and Aviva vaccine clinics? Yes, not as many as we would like. So if there's anybody out there who's been on the fence or just hasn't gotten around to it, and I know a lot of young people, and I've talked to them, and there are a bunch of people that are like, oh yeah, I only get around to it sometime, like I only get around to paying my taxes sometime or mowing the lawn or doing those things. They're just putting it off. Now's the time to do it. The Tiger team is this group of people who goes around to little clinics in the outlying areas. The Aviva vaccine clinics are held regularly around the area. We're going to have another big vaccine event on May the 15th at the fairgrounds. It's going to be a Pfizer vaccine, eligible for everybody 16 and above, maybe even younger if they approve it for people younger. And the answer is yes. Stacy also asks, are there any variants? She talked about the UK variant, but are there other variants here in the county? And the answer is yes. The good news on variants is that we do get the data. The bad news is it's a little bit late. So we have had in the county, you'll remember about a month ago, we talked about the P1 variant from a traveler from South America, just that one case. We've had some of the 427 and 429. That's the Southern California variant. People from California come up to Oregon, and we expect to see that. There were 5 cases of that Southern California variant. There was none of those that were particularly unusual. There was one of those outbreaks which did seem to get lots of people, but there was not a particular high level of illness from this. And then we've had 2 confirmed cases of the B117 or the UK variant. Again, there was nothing particularly unusual, except when you look at the people who have these variants, they tend to be much younger. And we don't know if that's because these variants attack younger people or that younger people are just the kind of people who are going to be moving about more. Right, so maybe if you're my age, you sit at home a lot. Maybe if you're 22, you go to parties and see friends. So it wouldn't be shocking that it would be there. So yes, we've seen some variants. In general, the variants don't look that unusual from others. And we don't know about the vaccine in the P1, but we do know that the vaccine seems to work well against the B117, the 427 and the 429. So had these people been vaccinated, we would see that. In fact, when we look through our breakthrough cases, those are people who've had it. There's only one that has had a variant. So again, that doesn't seem to be that unusual. And that then gets to the question of breakthroughs. Tell us about breakthroughs. Yeah, there are breakthroughs. The state reported yesterday that there were 600 breakthroughs. We've had 7 in the last month or so. And so that's going to happen. If the vaccine was 100% effective, you'd have no breakthroughs. But the vaccine is over 90% effective, and that's why you have so few. Again, we've had seven breakthroughs in the last 2 months. We've had 700 cases, which means that 693 of the 700 weren't fully vaccinated. And in fact, most of those weren't vaccinated at all. So again, overwhelmingly the vaccine works. Overwhelmingly the vaccine is safe. And so we're encouraging people to get the vaccine. So someone says, are the vaccines being delivered around the county to our most rural areas? And the answer is yes. I'm really proud to announce that we have a team here, the Tiger team. You may have seen about it in the newspaper. And this Tiger team is great. There's 6 of the most impressive people on this, ranging from an ex-fire chief to nurses to all kinds of people who are working to put this together. The county has provided us with 2 vans to do it. Aviva provides us with the vaccines. Umpqua Valley Ambulance provides us with the people who actually put the vaccines in arms. And they're going to, I'm going to read these areas off: Azalea, Glendale, Days Creek, Milo, Tiller, Riddle, Toketee, Diamond Lake, Idlewild, Melquah, Sutherland, Camas Valley, 10 Mile, Rice Hill, Curtin, Scottsburg, Elkton. So you can think of a more remote place than that. We don't really have one. And when we've looked around the county, we looked yesterday at the rates in zip codes. So in some areas of the state have one place that gives vaccine, and the zip codes around that one area have high rates, and then as you get further and further away, the rates go down. Douglas County, that doesn't seem to be the case. Our rates, when we looked at them, were fairly similar among them. Actually, the highest rates in the county were in the Reedsport, Scottsburg area, where Lower Umpqua Hospital has done an outstanding job in providing them vaccines. Our lowest rates were in the Riddle area, and that's where we're going down to Riddle. Several times to go ahead and get them caught up. But again, if you live in one of the rural areas, we'll send you out our Tiger Team schedule. They're really going all around. Now, the Tiger Team is not the most efficient way to deliver a vaccine. Right? The most efficient way is like the big event at the fairground, at the Salem Fairgrounds, where they were given 5,000 doses a day. We're given 20 to 60 doses a day. Because there's just not that many people in Tiller. But we're doing a great job, and I think we're getting those people vaccinated. They're getting vaccinated in their home communities, and we think that's great. So that's what we're up to. And it's really fun. These guys are just a riot. So if you get a chance to go to one of their Tiger Team events, they are just a riot. Okay, let's see what other questions we have here. Coming through. All right. And so if you want to look on Facebook, there's a little video from the winery. They were at Cole's Vineyard earlier this week, and there's really a very nicely done video about that. So how many cases in schools do we have right now? About 6 cases in schools. Most of these, again, are kids who got it from their parents or teachers who got it from somewhere else in the area. We really do not think we've seen much spread in school. There's some spread, we think, in extracurricular activities like sports teams. We think there's some spread in that people on teams and people who go to class together tend to do other things together, right? Like you go to school and, hey, come to my house to play this new video game. That happens. And while at school, they're distance and wearing masks. Probably when you're home playing video games, you're sitting on the couch and not. So that's where we're seeing the spread. But again, one of the bright spots in this whole thing is that there's not a lot of spread in schools. Sal says, has COVID spread through food? We do not think so. So, again, it's a little hard to know, but there's no good cases where people get this through food. Unlike many other diseases we follow, right, E. coli, norovirus, that so clearly goes through food. This one does not seem to go through food. Now, the Chinese worried that the way this got through the wet market was on frozen fish. And so we can't say no, but it does not appear to be a major way to do it. Similarly, surfaces don't appear to be a major way that the disease is spread. So if you get so Ronnie says, if you get the booster, does it have to be the vaccine or can you mix? We do not know the answer to that. Again, there's a lot of talk about boosters, but nothing official. So Veronica says, do you think Americans are coming back from India and bringing home the more aggressive variant? I think that is very likely to happen. In every way this has happened. You can imagine if you are in an area, an American in an area where there's all this disease around you, where the only sound you're hearing is ambulances, and in India where they cremate the dead, fires of people being cremated, that you would want to come home. And even if you were a little sick, you would come home. And so we are very, very, very worried about that. I'm really hoping that we don't make the same mistake we made the last 3 times that there were outbreaks, which was not to properly isolate them or quarantine them. So if the deal is that you come back from India, we're going to appropriately quarantine you, which is 2 weeks of quarantine, not really at home, 2 weeks of quarantine at a place where you really can be quarantined, then what's going to happen is this disease won't spread because you don't carry it for very long. So Veronica says, I thought you said kids were not super spreaders. Are they? Why vaccinate them? So the younger kids do not appear to be super spreaders. So kids less than 12 do not, even though they get the disease and they have a fair amount of virus in their nose, which actually was for us surprising, they don't seem to spread a lot. But once you hit puberty, you do seem to spread it, and you do seem to spread it pretty efficiently. So 12 to 15-year-olds, most girls go into puberty before that, most boys a little after that, but 12 is usually what we think about as being the pubertal age, and that's why there's been this drive to get them there, because we do think that once you hit puberty, you do spread this very efficiently, and that's the reason we would vaccinate them. So what's your recommendation of a 50-year-old woman who has a kidney transplant 30 years ago, and her doctor has left it up to her, and she's not sure? Oh, that's always hard when your doctor leaves it up to you. So I think if you've had a kidney transplant, the recommendation is still to get vaccinated. The people who would know most about these are the people at the transplant center. And so you might talk with your transplant doctor about it. But again, the recommendation is people, regardless of their immune status, to get vaccinated. Now, you may not get as good response as the healthy 25-year-old who's on no meds, but you may have some response, and there's no data of any troubles. So Veronica said, have you heard any eye issues? Yes, there are a bunch of minor things that people have had in their eyes. There was reports of twitching in the eyes. There were some reports of redness in the eyes. There were some reports of people thinking their vision looked cloudy, so that their vision looked foggy, like brain fog, although when they tested acuity and did other things, they didn't see the difference. But your eyes are complicated, right? So your eyes are not just your eyes. Many of the things that you see are a combination of what happens to the eyes and the brain. So when you get hit on the head and see stars, it's not the eyes that are making you see stars, it's the brain. And most or many cases of blindness are not because the eyes aren't working, but the brain is not working. So it could be from either the eyes or the brain. But there are a bunch of these minor eye things that we've seen. The other new one that's today is, not from the vaccine, but from the disease, is that people have had COVID. Later on, they're noticing a little linear line in their nails. And we've known about that for a long time. They're called Bose lines, B-E-A-U''S lines. And we see them in kids after they've had something like hand, foot, mouth disease, or after they've had strep throat. And so you'll see a kid in the office and you'll look and you can tell by how far the line has grown out, how long ago they had it. So, a look at the line and say, oh, it looks like you had something bad about 3 nails grow about, they grow a small amount, millimeter a week. So if it's 7 millimeters out, you'd say, something happened 7 weeks ago. And how did you know that? And the answer is, just smart. No, you look at the nails and you can tell that. So that's been one of the other things. The other thing that's been happening with COVID, the disease, not the vaccine, is something called telogen effluvium, which is a nice phrase, but it's hair that falls out about a month or two after a traumatic event. So sometimes after surgery, sometimes after weight loss, sometimes after you deliver a baby, sometimes after just a big emotional shock, what will happen is your oldest hairs will fall out. So typically what happens in your hairs is they grow for about 3 years, and then they stop growing, they rest for a little bit, and then they fall out. And so every day you're losing hair. And because your hair can only grow for 3 years, there's kind of a limit to how long you can grow it, which for humans is usually down to your butt. Occasionally you'll see somebody with hair longer than that, but usually not, because hair only grows maybe an inch a month. And so it grows an inch a month. It only grows for 3 years, so the most it can grow is about 36 inches, which is about down to your butt. Unlike fingernails, which continue to grow, and so your fingernails can be feet long, very many feet long, and you've seen those disgusting pictures of people with 4-foot nails, because nails continue to grow, but hair doesn't. Grows for 3 years, rests for a few months, and then stops. But if you've had a traumatic event, what happens is a lot of hairs go into the resting phase and then fall out, and then you have a lot of hair that you lose. The hair will grow back, but it really can be scary. So not uncommonly, we have people who've had a bad trauma, surgery or something else, and they come a month or two later, so, oh, my hair's fallen out. And you can look at the hairs and look at the ends of the hairs, and you know that it's telogen effluvium, and you can reassure them within a month or two your hair will grow back. The other thing, interestingly, that happens with this is the hairs that fall out are your oldest hairs. So for people who've got some black and some gray hairs, what happens is the ones that fall out are the black hairs. And so what happens then is you look much more gray over the space of a few weeks. So probably everybody can remember a story where they looked at someone and they said, oh my God, they went, spouse died, and a few months later they're all gray. And it's probably because they had some telogen effluvium and lost that. So again, this is something we're also seeing with COVID, and what it makes some of the survivors looks like they've aged 10 years with the illness. Some of that is just cosmetic because they've lost dark hairs, but many of the people who survived a hospital stay with COVID have told us that they don't feel good again for weeks or months after they left the hospital. So even though younger people are not dying as much, these hospital stays they're not going to be back to work in a few days. These people are really going to be quite sick. Okay, another question we had is about viral shedding, and there was a thing today about you could shed virus, and I haven't really understood this, but I think I got a better understanding of that today. So viral shedding does occur. So the idea that you could be chronically infected with a virus and shed it to others is a common thing. And so we see that, for example, with people who have chronic hepatitis B or chronic hepatitis C infections. So when you have chronic hepatitis B or chronic hepatitis B, you carry the virus for a long time, and you can shed it to others. And that's a big concern, and that's why, for example, people with hepatitis C are cautioned about sexual activity because they don't want to pass it to others. Similarly, there are viruses like HPV, which is the virus that causes kinds of cancers, and people who have that can get chronic infections and shed it. So viral shedding clearly does occur. Viral shedding definitively does not occur with coronavirus. So it's not like you could have this vaccine and shed it. The longest shed ever with this has been 20 days in immunosuppressed people. In people who are normal immune systems, it's 9 days. And guarantee you that people are looking for people who will shed it longer than 9 days. And you just don't shed it longer than 9 days. And that's why we require that people who have the disease isolate for 10 days. If they're immunocompromised, or if they're in the hospital, they isolate for 20 days. But then after that, those are the people you can be sure are not spreading the disease, because there's no spread after 9 or 10 days. So the idea that you would get the vaccine and then be shedding the virus for days or weeks, that doesn't occur. And I can sort of get where maybe somebody got that from, but that does not occur. So viral shedding is not an issue. Similarly, we had a question this week about somebody who got the vaccine and then tested positive. Could they test positive because they got the vaccine? And the answer is no. There's 0 cases of that, and there's no plausible biological mechanism for that. Okay, we had one more question. The vaccines for 12 to 15-year-olds. Okay, I think that's it. That is great. So it should be a nice weekend where we're hoping that people do is rest, do some outdoor activities. Again, outdoor activities are very safe. If you are vaccinated, you don't need to wear a mask unless you're going to be in really crowded conditions outdoors, which is a good thing. Please think about getting a vaccine. Again, the 15th, we're going to be doing an event at the fairgrounds using the Pfizer vaccine. That vaccine is approved for everybody 16 and above. We're going to be doing second doses for people who got their first dose 3 weeks ago. We're going to be doing first doses for anybody else 16 and above who wants it. And if the approval comes through to do with people 12 and above, we'll do it for them. For people for 12 to 15, they need the parents' consent. For people 15 and above, they can consent for themselves. So it'll be a little more complicated, so we'll have to get, for the 12 to 15-year-olds, need to get the parental consent, but we'll do that, and we'll hope to get it through. Again, it looks like the vaccines are our best way out of this. We've gotten some kind of angry stuff about the vaccine, that we're somehow forcing it on people. You guys have been listening here. I certainly have strongly recommended it. I certainly have cajoled, but we have tried really, really, really hard not to denigrate people who do not want to get it. We have tried really hard not to call people names because they don't want to get it. But this is our time where we can come together and we can get the vaccine. We can drive the rate down to 1 case per 100,000 per day. And when we do, you won't have to listen to me on Facebook twice a week. Again, this is Dr. Bob Dannenhoffer. Be safe, be kind. Thanks.